dental implant cost. What influences how much this is going to be?
Yes, there's a lot of factors that influence the cost of your treatment. And I'm really big about giving people options. I don't like to pigeonhole people into one particular treatment. So it depends on what you want out of life, like what kind of quality of life you want after you have your treatment. But there's the cost of the materials in doing your procedure. There's the time that it takes. A lot of these surgeries nowadays can be done in one visit. They literally can. And that does drive down the cost. But if you're in a case where you need multiple procedures, then there is some cost that goes into that.
Like bone grafting, things like that?
Yeah, correct. So the infection can sometimes do some damage to the mouth that we have to repair first, quite honestly. And there's expense that goes into that. But I think a good thing to remember is, whether it happens in one step or two steps, there's a lot of things that are possible now that weren't possible 10 years ago when we first started doing this show. So that's what I'm really proud of, is being able to find a solution for everybody.
So snap in, snap out is one option, less expensive.
Correct.
On both. Then there's the teeth that don't come in and out. Mm-hmm. I guess there's like 100 different types of implants you could put in. You've told me that there's even different materials you can make the teeth out of. What are some of those materials? Yeah,
so some of the materials, we started off using acrylic when we first started doing these, and the teeth would break sometimes. We're on to using zirconia for every single case that we do. All of our permanent teeth options are done in full zirconia. And I think there's this tactic out there where some offices will, quote you one price and tell you that that's the acrylic, or, this is another price for the zirconia. I don't even do acrylic anymore. Everybody gets zirconia when we do.
So when I see things, I want to get your take on this. So when when we see Google ads with like $395 or $995 for an implant, are they just pretty much quoting what that titanium post cost oftentimes?
Yeah, so it is a little deceptive, and
so you don't like that?
Absolutely not.
Okay.
I think you know me pretty well. I'm a very straightforward person, and I pride myself in being upfront with people, because I don't want to get you into the middle of this process and have to tell you it's more money. I'm very passionate about you being able to make a decision with accurate financial information before you even start. Okay. That's really, really important to me. We have this sort of motto that we use in our office: one doctor, that's me, one office, you're not going to have to go to multiple offices, and one fee. So whatever it is you want, I like giving people options. There's a good, better, and best in everything we do in life. And I understand if best isn't in your budget, we can do what's good, and that's where we talk about, just adding a couple implants to dentures, or doing 4 implants on the top, 4 implants on the bottom is the second option that I typically give people. That's sort of the middle of the road cost. I believe there's a lot of value there, because you get a lot for what you pay for there. And then there's a permanent teeth option. It is the most expensive option.
The teeth that don't come out.
Correct. The permanent ones that don't come in and out.
And you're less than the big guys on the permanent teeth.
Yeah, and I believe there's some economy in what we're doing here. We're doing so much of it. We do it all in one place. Over the years, I've learned how to spend my patients' money more wisely. Like, I know where to use expensive materials, and I know where, we don't have to.
Okay.
And so I really like doing this dentistry, Randy, and I'm in this to help find a way for people to do it.
And financing is a big part of this. I guess across the country, most people are financing the bigger dental procedures.
Yeah,
is that the case in your practice?
It is absolutely the case. It is a rare occasion when somebody comes in and just pays cash for the whole procedure up front.
Oh, really? Okay.
Yeah. We have several ways that we help people get started. We can break this up over time and pay over time. Okay. We can find a way to finance it. We have several what I believe to be very unique financing options in my office. And you have to talk to my team about that, because my area of expertise is the dentistry.
Okay.
They're really good with the money part of it. But they have designed some financing options and met some financial partners that have been able to help people get started with treatment, whereas they would not have been
So
before.
Your credit score could be above 600? Or so, or 650?
Again, those are great questions that I don't know the exact answer to.
But you don't have to have perfect credit to do this these days.
I think that's the message. Like, if you think your credit is less than perfect, knowing is half the battle. Come in and let us help you figure something out. We have a number of options that may work within whatever situation that you're in. We have a relationship with a local bank. We have several financing companies that we use. Again, Medicare is a non-traditional way to help people get into dental implants sometimes.
I mean, you're one of the few guys that looks at Medicare and tries to get some money out of Medicare.
Correct.
Is that right?
I don't know of anybody else in town doing it, and if I did, I would tell you. But again, I am a Medicare certified provider because of some of the dentistry that I do in the hospital setting, and we've learned how to apply those medically necessary situations to people with Medicare.
What's the most you've ever got reimbursed from Medicare? Can I ask you that?
It's a tricky question.
Over $5,000, over $10,000?
Yes. So if we're doing 2 arches for somebody, I can guarantee them $14,000 from Medicare.
Is that right? A reimbursement?
Yeah. And and again, we are so confident in that process because we've been doing it a long time, and it stood the test of time. That if you have Medicare, we need to verify that your benefits. I want to be very careful with what I say.
Okay.
Because we need to verify your benefits, and because there's a bunch of different Medicare plans out there. If you have Medicare as your primary insurance, straight Medicare, we can work with that. Okay, and I do go so far as to guarantee people those benefits. Meaning, if I don't get,
that's very nice.
Yeah, I believe it's very generous.
I talk to dentists and they say, "I'd love to take Medicare, but I never get paid."
Yeah.
So you figured out a way to get paid.
Yeah, and again, I go so far, and I'm so confident in the procedure or the process of doing that I guarantee it to you.
Wow.
And what that means is, just let me explain that, is if I don't get paid by Medicare, I don't charge you for that portion of what I've quoted you. Again, I said this from the beginning, I'm very upfront with people with what I can and can't do for you. And I can do a lot of things for people, but if I can't do something, I'll tell you.
I mean, you've been stubborn about this Medicare, because I remember at the very beginning, one of your other dentists that worked with you was saying, "I don't know, I think it might be a waste of time to try to get reimbursed," and it turned out you won.
I was actually very skeptical at the beginning as well.
So it's a big part of what you do now.
Yeah, I've met other people, other dentists in other areas of the country that have been doing this for a long period of time. I've been doing it for several years now.
Good for you.
But again, I'm very careful about getting people's hopes up. We have to check.
So once you get the diagnosis, meaning the exam and everything else, the imaging, you can pretty much say, "This is what I think it's going to be covered."
Yeah, if you come in for a consultation, I can tell you on the spot whether you qualify or not, and whether you have the insurance or not.
Okay, good. So that's the dental implant. I want to thank you for coming on the program. Yeah. Always a pleasure.
Thank you.